Hi, and thank you for joining me. My name is Nathan Evans. I'm an RN BSN student at Arizona State University. During this presentation, I'm going to discuss the prevalence of cholera in Sierra Leone. So let's get started. So when we talk about cholera, we ask ourselves, what is it? Cholera is an acute intestinal infection that is caused by the bacteria Vibrio cholerae. The bacteria is acquired by ingesting contaminated food or contaminated water. However, most cases are caused by ingesting unsafe drinking water. Once the bacteria is ingested, it produces toxins that penetrate the cell walls of the intestine, which inhibits the intestines from absorbing water. The most prominent symptom of the infection is severe profuse diarrhea, which is usually characterized as rice water stools. The infected person can also experience vomiting, tachycardia, hypotension, and death can occur within several hours if cholera goes untreated. Sierra Leone is a country in Western Africa, and in comparison is slightly smaller than South Carolina. To put things into perspective, Sierra Leone has a population of approximately 5,600,000, while South Carolina has an approximate population of 4,700,000. Sierra Leone has a tropical climate with its rainy season from May to December and its dry season from December to April. The geography in Sierra Leone ranges from coastal swamps, wooded hill country, upland plateaus, and mountains in the east. Sierra Leone is comprised of a typically young population, with almost 42% of the population being between 0 and 14 years of age. The median age is 19 years, and there's an average life expectancy of 56 years. Sierra Leone is ranked 11th in the world with an infant mortality rate of 74.95 deaths in every 1,000 births. Sierra Leone suffers from rapid population growth, slash and burn agriculture, overharvesting of timber, and has recently gotten through a civil war. Cholera originates in the Ganges Delta in India, and the first pandemic was in Southeast Asia in 1817. In 1854, John Snow was credited with linking cholera to contaminated drinking water in London. The first vaccine was developed in 1885 by a Spanish physician, and Robert Koch first visualized Vibrio cholerae under the microscope in 1883. In 1967, the rehydration protocol was developed by Robert Allen Phillips. Now we are going to discuss the epidemiology of cholera. We will use the epidemiologic triangle, which consists of an agent, a host, and an environment, to help identify causative factors, transmission, and risks related to cholera. The agent is the bacteria itself, Vibrio cholerae. V. cholerae occurs in aquatic sources and enters the digestive system by ingestion of contaminated food or water sources. It exits the body through feces and has a typical incubation period of 2 to 5 days. We humans are the host for V. cholerae. It affects all ages, races, and genders equally. However, those with low immunity are at an increased risk of death. The environment in Sierra Leone is very suitable for V. cholerae. The tropical climate allows the bacteria to flourish, while the overcrowding and unsanitary conditions of the slums allow for easy transmission. The poverty-stricken regions of Sierra Leone lack the proper resources, such as clean water, water purification systems, and the proper education to prevent a cholera outbreak. The true burden of disease of cholera is estimated to be between 3 and 5 million cases and between 100,000 and 120,000 deaths worldwide every year. In Sierra Leone, and as of September 19th, there were more than 19,000 cases of cholera and 274 deaths that were due to cholera. According to the World Health Organization, Sierra Leone is in the midst of its worst cholera outbreak in 15 years. The greatest number of new cases are being reported in the capital city of Freetown, where unsanitary slums are the majority of housing. There are projections that suggest that as many as 32,000 new cases could be suspected to come up in this outbreak. The problem with cholera in Sierra Leone is the fact that water and sanitation remain a long-term challenge, particularly in the urban slums in the Freetown area. With the estimated 32,000 new cases, there is an incidence rate of 570 cases per 100,000 people. And currently, there is a shortage of oral rehydration salts, which are the mainstay in treatment to combat dehydration caused by cholera. The health sector in Sierra Leone also needs approximately $1.2 million to sustain its efforts, which finds to be hard to come by in such an impoverished country. So how do we find a solution to the problem? First, we have to treat those affected. Oral and IV therapy is the mainstay of treatment for cholera. Antibiotics such as doxycycline is recommended for adults, and azithromycin is recommended for children. However, use of the widespread antibiotics is not recommended due to possible developing drug resistance. Many of the people in Sierra Leone are not able to afford such antibiotic treatment. So with cholera, prevention is key. Drinking and using safe water is the number one way to prevent cholera. People are asked to move away from water sources and dig a hole to have bowel movements and to urinate in. They are also taught proper hand washing techniques. There are vaccines available to prevent cholera, but much like the antibiotics, they are not easily affordable. There are several cultural aspects that affect the incidence of cholera in Sierra Leone. Approximately 70% of the population live in poverty and have unsanitary living conditions. Many do not have access to clean water and are unable to afford treatment for cholera. There are several organizations doing what they can to aid Sierra Leone. The CDC offers their WASH program, which helps by giving access to safe water, adequate sanitation, and proper hygiene education. The CDC also provides their Safe Water System program, which protects communities from contaminated water by promoting behavior change and providing affordable and sustainable solutions so people can treat water in their own homes. The World Health Organization uses its Global Task Force on Cholera Control, which was formed in 1992 in an effort to reduce mortality and morbidity caused by cholera. There are also several other agencies such as UNICEF, the British Red Cross, and Save the Children that provide aid in the form of food, water, and clothing. Below I've attached a list of the resources that I used for my presentation. I hope you all enjoyed the presentation, and if you have any questions, please don't hesitate to ask, and I welcome any feedback. Thank you, and take care.